Moving forward to our second session, that is Piles to Smiles, Modern Solutions to Hemorrhoids by Dr. Raghuteja Padma. Let's hear it from Dr. Raghu. Go ahead, doctor.
Yeah, thank you, Ajay, for giving me this opportunity. Can you see my screen?
Yes, doctor. You need to start the presentation.
Okay, is it clear?
No, it's not full screen on. It's not showing on the screen.
Now? Now?
No, doctor, it's not going full screen.
No, there's some problem with full screen. If it is showing,
yeah, it is showing. Then you can continue this way. No
yeah,
problem.
we'll continue
Go
with
ahead, doctor.
this.
Yeah.
So the main ideology here is piles to smiles. One thing, people are in a big dilemma whether to reach the doctor or not. They will keep the piles themselves for years together. So ideology here is it is the advances have become far better these days that they can easily come and contact the doctor or surgeon, and the surgeries now we are doing either sclerotherapies or whatever the advances have been performing in recent days for the hemorrhoids are far better when compared to the previous days. So the main motto of this presentation is there is nothing to be worried related to hemorrhoids. Anything related to hemorrhoids is far more simpler these days. So that is what the main motto. Coming to piles, what are piles? We all know piles are nothing but the blood vessels, mainly venous blood vessels, which dilate in the perianal region. So there are three blood vessels in the perianal region, mainly rectal veins. These veins dilate. Why? There are different reasons that will come in the next slide. But what are the main symptoms of piles? First, there will be bleeding. There will not be pain in hemorrhoids. Pain will be there in the fissure. So fissure is there is cut in the anal canal or the that anal ring region. Hemorrhoids are dilatation of the blood vessels. This is the main difference. Patient need to know that whether he has a fissure or piles. So piles, they will have main symptom is bleeding. Then pain is very rare. Pain will be there whenever there are external hemorrhoids. So there are two different types of hemorrhoids, internal and external hemorrhoids. There is a dentate line in the anal canal. Whenever the hemorrhoids happen above that dentate line, we call them as internal hemorrhoids. Below that dentate line, we call them as external hemorrhoids. So whenever there are external hemorrhoids, patient will have pain, but internal hemorrhoids, mostly they are painless. And the one more other symptom is itching and swelling, discomfort during bowel movements. These are the main important symptoms. Now coming to the causes and risk factors, one important thing is if there is straining, if there is any pressure on the blood vessels or rectal veins, there will be dilatation of the veins. So how there will be pressure? Say for example, there is increased abdominal pressure in the abdomen. This may lead to the pressure in the rectal veins. So what are all the causes of the increased abdominal pressure, or indirectly the causes of hemorrhoids? So causes of increased abdominal pressure is like one, obesity. Because of obesity, there will be pressure on the rectal veins and there will be dilatation of the rectal veins. Second is pregnancy. Again, pregnancy, there will be increase in the abdominal pressure, and that pressure there will be increased pressure on the rectal veins, which leads to hemorrhoids. Similarly, chronic constipation. What happens in the constipation is people strain to relieve that motion or stool. Then they'll be, because of that strain, there'll be pressure on the rectal veins leading to hemorrhoids. Again, there will be fibroids, the huge fibroids in the uterus, which causes iliac vein pressure on the iliac veins, which indirectly leads to again hemorrhoids. Some people will suffer from chronic liver diseases, what happens in chronic liver diseases is there will be ascites formation because of protein deficiency. In liver disease patients, there will be deficiency of four vitamins A, D, E, K, and there will be deficiency of protein, which leads to development of ascites formation in the abdomen. That again leads to increased intra-abdominal pressure and hemorrhoids formation. So these are some important lifestyle related issues and other chronic diseases related issues which may lead to hemorrhoids. So these are the classifications which we have already discussed, that there will be a dentate line in the anal canal. Above that dentate line, if the hemorrhoids happen, they are called as internal hemorrhoids. Below that dentate line, they are called as external hemorrhoids. So for internal hemorrhoids, there are grades, grade 1, 2, 3, and 4. So there are different types of grades. Based on those grades, we decide what exactly need to be done to the patient, whether to go ahead with lifestyle changes or go ahead with sclerotherapy injections or laser hemorrhoidectomy or stapler hemorrhoidectomy. So depending on the grade, we'll decide. So grades are divided in such a way whenever the hemorrhoid is even after say for example it is a grade 1 disease. In grade 1 disease, the hemorrhoid will come out and it will go inside on itself. In grade 2 hemorrhoids, the hemorrhoid will come out, but it will go inside on some pressure. Either in grade 3 hemorrhoids, the hemorrhoids will come out, internal hemorrhoids will come out of the anal canal, but they will reduce whenever the patient tries to push those hemorrhoids inside. In grade 4 hemorrhoids, even after a lot of trial from the patient side, the hemorrhoids will not reduce. These are different types of grades. Based on these grades, the management will differ. So diagnosis is medical history, which is very important because medical history helps in like what exactly the patient is suffering from, either chronic liver disease, or she is in pregnancy, or he or she is having any constipation issues, something like that. So which helps in the diagnosis part. We'll do mainly clinical examination by doing per-rectal examination. In per-rectal examination, we will know that whether the patient is suffering from grade 1 or grade 2. If at all it is needed, we perform a proctoscopy as well to distinguish between the grades or internal or external hemorrhoids. Then coming to this part, latest techniques, which is very important because patients are in a different picture, that whenever someone has hemorrhoids, definitely they have to go for surgery. So keeping this in mind, patients may not reach the doctor, that definitely the doctor will advise me a surgery, and surgery at the anal region is like a everyone knows that it is like a different kind of trauma, and psychological part will also play. So reason why especially in India, especially women will not reach surgeons for this type of issues. But from in this platform, I wanted to explain that things has become too much easy. Like there are different types of techniques we do, minimally invasive procedures. Laser hemorrhoidectomy is one such thing, which is a beautiful surgery that we do for hemorrhoids. Even for grade 4 prolapsed hemorrhoids as well, laser is doing well, because there will not be pain, one. Second, there will not be excess bleeding. Previously, traditionally, what we need to do is they'll need to clamp that hemorrhoid and excise the entire hemorrhoid, and we need to ligate that hemorrhoid, which may be traumatic, complicated, and there will be a lot of oozing from the wound. So now, because of this laser, there will be less tissue, or there will be tissue shrinkage. Laser hemorrhoidoplasty uses a diode laser to precisely shrink, that will shrink the swollen hemorrhoid. Even for prolapsed hemorrhoids, say grade 4 hemorrhoids also, laser will shrink the hemorrhoid. Then it will be very easy to excise that hemorrhoid. which is minimally invasive, causing minimal pain and faster recovery, fewer complications, and even a hospital stay has like previously patient need to stay like for 1 week or 4 to 5 days, but now within 1 day we are discharging the patient. So one more thing is sclerotherapy. Mainly we advise sclerotherapy for grade 1 and grade 2 hemorrhoids, and sometimes there will be thrombosed hemorrhoids. So for thrombosed hemorrhoids, what we do is we inject the sclerotherapy that will shrink, that will fibrose that hemorrhoid. The size of the hemorrhoid will come down. Then we'll excise the hemorrhoid with laser. So this is one more important thing coming to sclerotherapy. It will shrink the piles. It will shrink the grade. It will reduce the grade of the hemorrhoid. So this is a office procedure. We'll give injection, then within 1 or 2 days, the grade of the hemorrhoid will come down. Either we give one more cycle of sclerotherapy, or we go ahead with laser hemorrhoidectomy. So this is one more important advance, like Doppler guided artery ligation is what happens. We use a ultrasound Doppler in the OT will exactly ligate that artery which is supplying that hemorrhoid, which decreases the blood flow to that specific hemorrhoid, and that hemorrhoid again shrinks, which makes the surgery very easy, and the scar will be minimal. Blood loss also will be very minimal. So this is one more minimally invasive procedure which is helping for the hemorrhoids, Doppler guided. And stapler hemorrhoidopexy, mainly we prefer for grade 3 and grade 4 hemorrhoids. There is a stapler which we use to excise the hemorrhoids. Again, less pain and faster recovery. Through this, we can remove tissue, hemorrhoidal tissue, mainly grade 3 and grade 4 hemorrhoids. So this is one more advanced bipolar technologies. We have like bipolar instrument one. Second, now we have a ligature instrument as well. So even harmonic as well. We use those instruments. These instruments work very well to excise the hemorrhoidal tissue. With these instruments, there is very minimal blood loss, because hemorrhoids is nothing but a blood vessel. Whenever we try to poke or try to operate on that blood vessel, there will be huge bleeding. With these instruments like bipolar or ligature instrument or harmonic, there is very minimal blood loss in the hemorrhoidectomy surgery. Even scar also, there will be minimal scar. So there will be suture free, no need to suture, because if we use traditionally, we used to clamp the hemorrhoid and cut that hemorrhoid. There we need to suture that. So we will leave the suture there. That is an absorbable suture, however, but there will be a big discomfort to the patient while passing stool, after discharge, or during dressing and all. Because of these instruments like bipolar, ligature, and harmonic, and even laser, we are not at all suturing the wound. We are just leaving the area. Because of that, there will not be suture, and the discomfort of the patient will go down. So these are the main important advances which has happened in hemorrhoidectomy surgeries. One is laser, stapler hemorrhoidopexy, sclerotherapy, and bipolar ligature instruments. Traditionally, conventionally, we used to do this open hemorrhoidectomy. Now, even for grade 3 and grade 4, we are not doing open, we are performing laser hemorrhoidectomy. So these are the basic for grade 1 and grade 2 hemorrhoids. We can use these lifestyle modifications like dietary modifications, mainly include a high fiber diet. Hydration is very important, mainly electrolytes. People will forget, people will think hydration means only intake of water, but the intake of electrolytes, mainly magnesium, potassium, sodium, and chloride, all these are equally important, which helps in the hydration of because they help in the digestion part, in the bowel movement. So why some basic creams like lidocaine and all. and cold compression for the swellings if they are in grade 1 and grade 2. So avoid spicy food and caffeine or sugary drinks, some that. Then coming to lifestyle and prevention, mainly these days there is a problem with lifestyle, that is sitting. We are sitting we are sitting like hours together. So in the workplace or anywhere, even in the washroom as well, people are with mobile for even half an hour or 40 minutes. What this is leading to like pressure on the veins, on the thigh veins, which is creating negative pressure on the rectal veins and again leading to hemorrhoids. So better to avoid these type of habits, mainly bathroom habits, and better to go for pelvic Kegel exercises so that the pelvic muscles will strengthen, which may prevent again the hemorrhoids. And avoiding smoking is equally important, smoking and alcohol. Then anything like processed foods, outside junk food, people need to avoid that, which may lead to constipation again. And constipation is one more cause of again hemorrhoids. So consistent high fiber diet and exercise is the main key to reduce recurrence mainly. So because the main important part of hemorrhoids is not operating. Anyone can operate. Even these days, people are operating on the normal OTs. Like even in the OPs also they are doing like just giving anesthesia and excising the hemorrhoids. But it is not excising hemorrhoids. It is preventing the hemorrhoid, or it is like dealing the hemorrhoids at the root level. Mainly ligating the hemorrhoidal vein and artery is very important, which avoids recurrence. And following proper lifestyle habits will prevent recurrence in hemorrhoids. So when to see a doctor? Whenever there is a bleeding per rectum, or whenever there is pain, mainly bleeding after passing stool. In hemorrhoids, there will be bleeding after passing stool. In fissure, there will be bleeding. There will be streaks of bleed on the stool itself. On the stool itself, there will be bleeding streaks in fissure. But in hemorrhoids, there will be bleeding after passing stool. There will be 1 or 2 drops of blood in the commode. Then whenever patient sees this type of picture, better to consult a doctor, or any external hemorrhoids, any lumps, swellings, or pain, itching in the perianal region, better to consult your surgeon. So summary is gentle treatments for grade 1 and grade 2. We are not operating. Lifestyle and sclerotherapy will work. Grade 3 and grade 4, even if it is grade 4, laser is there, or stapler hemorrhoidopexy is there. So nothing to worry. Anytime, better to approach your surgeon. And we are specialized in treating these hemorrhoids through laser or stapler. So my advice is, don't neglect hemorrhoids. Prevention is the key. Home management tips need to be followed. The holistic approach for the hemorrhoids will work definitely. If it is in grade 4 or grade 3, like start with the lifestyle, then if possible sclerotherapy, then go for laser hemorrhoidectomy. So this is how need to be treated hemorrhoids. Take home message is, hemorrhoids are easily treatable. They are not like cancers, malignancy. They are benign blood vessel dilatations. They are not tumors. So nothing to worry. There are advances. There are sclerotherapy agents, laser, stapler, everything we are doing, and it is very easy. It is like a daycare procedure these days. So my advice is, don't neglect. Anytime you can reach me at ONUS Robotic Hospitals, Dr. Raghuteja, laser and laparoscopic surgeon, signing off. If you have any questions, please.
Thank you, Dr. Raghuteja, for that interesting session on piles, hemorrhoids, which is very important nowadays. going that there are these kind of diseases are very common nowadays, and there's a lot of stigma attached to it as well.
True.
So that's right. So thank you, Doctor. Dr. Raghuteja, I have a couple of questions for you because it's quite an important topic and also carries a lot of stigma around that. At what stage should someone seek medical help for piles instead of home remedies?
Instead of home remedies, whenever there is bleeding, so even in grade 1 and grade 2, there will be 1 or 2 drops of bleeding. But if it is continuously, even after like lifestyle changes or like even after taking high fiber diet, sits bath and all, if they are not, if they are recurring, if the bleeding is like for every 2 to 3 days, it is recurring, like the blood, 1 or 2 drops of blood in the commode, or there is any itching continuously in the perianal region, and if there is severe pain, sometimes if the hemorrhoid is thrombosed, there will be severe pain. So then definitely one has to reach your surgeon, mainly whenever they see the blood in the commode. So once it is fine, because sometimes even after taking spicy food, sometimes it will be there. But if it is repeating twice, thrice, then definitely you need to visit your surgeon, because examination is very important to rule out the grade. If it is grade 1 and grade 2, it is easily manageable with some 1 or 2 medications, with some one jelly and sits bath. If it is grade 3 and grade 4, then there are different ways.
Okay, thank you, Doctor. Another question I have for you is, how can diet and lifestyle changes reduce the risk of recurrence after treatment?
The main cause of recurrence in hemorrhoids is again constipation. People get operated for hemorrhoids, go home, they'll not do hydration properly, and they'll again fall into the pit, like take same food like without fiber and all. This leads to constipation again, and because as we have operated there, there'll be a raw area, so people are afraid of that pain, and there'll be constriction of the sphincter as well. So because of that constriction of the sphincter and pain, there will be like people strain in the commode in the bathroom. They'll strain for a long time. They think that I need to pass the stool now itself, otherwise it may lead to again recurrence. They'll be in that stigma. So one important thing people need to avoid is straining after hemorrhoids. So let it be either use a laxative or which was prescribed by your doctor, or have a high fiber diet with proper hydration, so that we can avoid constipation. And lignocaine jelly again will help to relax the sphincter. So that is a local anesthetic type of jelly which relaxes that sphincter, which opens up the anal canal ring. Then the stool will pass easily. All these things helps in passing the stool easily, so that constipation can be prevented. Main important thing for the recurrence is constipation post hemorrhoidectomy surgery. If one avoids constipation with proper hydration, high fiber diet, simple basic walking exercises, then definitely recurrence can be avoided.
Thank you, Doctor. Before we close, I'd like to ask one more question. What reassurance can you give to patients who hesitate to consult doctors about this condition due to stigma or even embarrassment?
Yeah, as already discussed, this is one most important thing which is now especially in India, mainly females in the rural areas, they will suffer with hemorrhoids for years together, will not reach doctors. Mainly even old age people, most of the old age people now, their sons or daughters, they are staying abroad in the cities. So even those old age people also, they suffer with hemorrhoids, but they don't express that disease with their sons or daughters. They'll suffer just like that. So what I wanted to say is this need to be addressed, especially mainly the sons or daughters who are staying in the abroad, they need to be free. They need to talk to their parents regarding this issue, that if you are suffering with any such type of issue, just you can explain. So this free talk has to be there with the parents, one important thing. Second, even in the rural areas, it is very important to create awareness. We have to go to the rural areas and need to address this thing. We need to assure them that we are here to create awareness, and we are always available to treat this kind of diseases. So don't worry if someone is suffering from such type of disease. This is one important thing. Awareness has to be created, which leads to reduction in hemorrhoid cases.
Thank you, Doctor. Thank you very much for that assurance and that encouragement as well. Well, that brings us to the end of today's webinar. On behalf of ONUS Robotic Hospitals, I'd like to sincerely thank Dr. Rajshekhar Papu and Dr. Raghuteja Padma for sharing their expertise with us, and to all our participants for being such an engaging audience. We value your feedback, and we request you to kindly fill our post-webinar survey that will pop up at the end of this session. Alternatively, it'll be also on your email, and you can fill it from there as well. Your suggestions will help us make future webinars even more useful and relevant. So thank you once again for joining us today. Stay healthy, stay safe, stay happy, and we look forward to welcoming you to our upcoming sessions. Good day.